Hello and welcome to the presentation on migraine headaches. There are many things you can do to help reduce the frequency or severity of migraines, such as powdered ginger in dosages ranging from a quarter to a full teaspoon 4 times a day. Acupuncture has been shown in studies to be superior to other modalities for reducing frequency. Give it some time, it can take 2 to 6 months. It can be important to identify triggers that may reduce your need for medications. I once had a patient who only had her migraines on Saturdays and Sundays, and when she realized that she was sleeping in on those days and moved back her waking time to her usual 6 a.m., her migraines disappeared, which was great for her, and it reduced her exposure to side effects from medicines. These are typical migraine triggers that you may want to look for. It can also be helpful to journal, to look for any patterns that include foods or travel or other things that may be triggering your migraines. I recommend supplementation with vitamin D3. It is good for many aspects of health and can reduce migraine frequency. Getting into some over-the-counter options for migraines. These are very helpful, and I wouldn't discount them just because they're old and not advertised on TV. High-dose aspirin, ibuprofen, naproxen, Excedrin, and caffeine with ibuprofen have all been shown to reduce the severity of a migraine. Just be sure not to use these things more than twice a week because your body can become dependent on them. Less robust evidence for magnesium supplementation, but certainly worth a try. Getting into prophylaxis. Prophylaxis would be preventing or reducing the frequency of your migraines. Some of these remedies, like butterbur or feverfew, go back centuries, and they are relatively safe. You can purchase them without a doctor's prescription. And you can try magnesium, riboflavin, also known as vitamin B2, or coenzyme Q10. These have all been shown in various studies to reduce the frequency of migraines. Moving on from there, second-line prophylactic agents. Second line because they carry more potential for side effects would include daily aspirin or naproxen. This concludes the migraine presentation. I hope that this information was helpful and evidence-based and empowering for you. If you have any questions, feel free to portal message me or set up a visit in the office or by telemedicine, and good luck.